Good morning. We have already discussed about the immunomodulators, which include both the immunosuppressant drugs and immunostimulants. Today, we will going to discuss about some salient features of the immunomodulators, especially the immunosuppressant drugs. First in the group is coming the glucocorticoids, which are the inhibitors of lymphocyte gene expression to reduce the inflammatory response. It is used to prevent the graft rejection. High dose of methylprednisolone sodium succinate, so that dose should be given in pulses. It is given by intravenous route and given in pulses, used to reverse the acute transplant rejection and acute exacerbations of certain autoimmune disease. So it is effective in controlling the graft versus host disease in case of bone marrow transplantation. The mainstay of the treatment for autoimmune disorders like the rheumatoid arthritis, like psoriasis, systemic lupus erythematosus, this glucocorticoid is one of the main way of the treatment. In transplant patients, glucocorticoids are additionally used to block the first dose cytokine storm, which is observed during the treatment with Immunomodulators CD3. Next group of drugs are the inhibitors of the lymphocyte signaling, like the calcineurin inhibitors like cyclosporin, tacrolimus, sirolimus, everolimus. These group of drugs has been already discussed in the last class. Group 3 is the cytotoxic agents to reduce the lymphocyte proliferation. Under this group, first is the antimetabolites like the azathioprine, methotrexate, myclophenolate, mofetil and leflunomide. Alkylinating agents is the cyclophosphamide. So azathioprine is one of the main immunosuppressive cytotoxic substance. It is widely used in the transplantations to control the rejection reactions. It is non-enzymatically cleaved to 6-markup to purine that acts as an purine analog and inhibit the DNA synthesis. So there is an immunosuppression and it is acting as a cytotoxic agent. Methotrexate, it is an cytotoxic antimetabolite used in the cancer chemotherapy. It also has the immunosuppressant action due to its action on the lymphocytes and other cells of the immune system. It has been reported to enhance the apoptosis of the activated but not of the resting CD4 and the CD8 T cells. So it enhances the apoptosis of the activated CD4 and CD8 T cells. It is used to treat the graft versus host disease, rheumatoid arthritis and psoriasis. The most common toxicity is the nephrotoxicity due to precipitation of the drug in the renal tubule. Cyclophosphamide, it is also acts as an unique immunosuppressant agent as it suppresses the B lymphocyte proliferation but can enhance the T cell response. Organ transplant recipients, it has been used for benefit of the patient and due to immunosuppressive actions. The toxicity and the side effects, both important is the bone marrow depression, severe nausea, vomiting, and most important side effect of cyclophosphamide is the hemorrhagic cystitis due to the renal damage or erycoline, that is a constituent which has been produced, that is producing the hemorrhagic cystitis, and this can be minimized by the high fluid intake or infusion with the use of mesna. So you have to remember the hemorrhagic cystitis, which is caused by cyclophosphamide, can get rid of with the infusion and the use of mesna. Another side effects is the sterility and the hypersensitivity reactions. Anti-cytokine antibodies. Anti-cytokine antibodies, among these most important is this infliximab, adalimumab and etanercept. So these are the tumor necrosis factor alpha inhibitors. In the group B, interleukin-1 receptor antagonist, anakinra and rilonacept. In the group C, interleukin-2 receptor antagonist, example is the daclizumab and basiliximab. All these are the monoclonal antibodies. Interleukin-6 receptor inhibitor, tocilizumab. Interleukin-12 P40 cytokine inhibitors, ustekinumab. Interleukin-17 cytokine receptor inhibitors, brodalumab. So, among all these drugs, importance are the etanercept, infliximab, adalimumab, anakinra, basiliximab. All these are the important monoclonal antibodies. So, infliximab is a chimeric monoclonal antibody. Chimeric is a mixture of the mouse and the human monoclonal antibody. So, it is a chimeric mixture. So, it is a monoclonal antibody which is used for the treatment of the Crohn's disease and rheumatoid arthritis. The better clinical benefit is obtained when this has been used along with the methotrexate. Adalimumab, it is a human recombinant monoclonal antibody. So, it has been produced by the recombinant technology or engineering, and it is antibody to the tumor necrosis factor alpha. It is less antigenic than infliximab and used in rheumatoid arthritis. Anakinra, it is a recombinant form of interleukin-1 array which inhibits the interleukin-1 interactions with the immune system. Hence, it is used for the treatment of the rheumatoid arthritis. It is given subcutaneously, so injection site pain and flu-like syndromes can occur. Rilonacept, it is a new fusion protein that binds with the interleukin-1 being evaluated for treating gout. Daclizumab, it is again one chimeric humanized monoclonal antibody. Basiliximab, it is a murine and the human chimeric monoclonal CD50 antibody. Both these drugs are used for the prophylaxis of the acute organ transplant rejection. Acute organ transplant rejection. So, these daclizumab and basiliximab, these two can be used for the prophylaxis. Tocilizumab, it is used for the treatment of polyarticular juvenile idiopathic arthritis. Brodalumab, it is undergoing investigation for the treatment of rheumatoid arthritis and the Crohn's disease. Group 5, these are the antibodies against the specific immune cell molecules. It may be the polyclonal antibody like the antithymocytic globulin or monoclonal antibody. For example, alemtuzumab, which is used for the treatment of the B-cell chronic lymphocytic leukemia. Immunomodulators, CD3, it is used for the prevention of the acute allograft rejection. Allograft means it is from the same species, the graft has been taken. So, allograft rejection after the kidney or liver or the heart transplantation. So, immunomodulators is used for the prophylaxis of the rejection for the allograft. So, what will be the adverse effects? The cytokine release syndrome, it can be minimized with the help of the glucocorticoids along with the antihistaminic. Omalizumab, very important, it is an anti-immunoglobulin E antibody. So, it is used for the treatment of allergic asthma resistant to the inhaled glucocorticoids. Omalizumab, it is very common question, which monoclonal antibody or what is the newer drug for the treatment of allergic asthma? Rituximab, it is an anti-CD20 monoclonal antibody. It is used for the treatment of B-cell lymphoma and chronic lymphocytic leukemia. So, B-cell lymphoma and chronic lymphocytic leukemia. Basiliximab, it is an anti-CD25 MAP used for the prevention of the organ transplant rejection. Alifacept, it is used for the treatment of chronic plaque psoriasis. It is again a newer drug, and for the psoriasis, it has been evaluated for the treatment. Group 6 is the inhibitors of the immune cell adhesion and the activation. Just example, ifalizumab, and inhibitors of the immune cell co-stimulation. Among these, importance are the abatacept and belatacept. All these are the newer group of drugs. Now, in the miscellaneous group is the RHOD immunoglobulin. It is, everybody know about the anti-D antibody, so it is the RHD immunoglobulin. Now we are coming to the immunostimulants and the immunomodulators. Among the immunostimulants, you know the BCG vaccine can be used as an immunostimulant, levamisole, which has already been discussed, thalidomide, recombinant cytokines. This is very important, and among it is important is the aldesleukin. It is used for the treatment of the metastatic renal cell carcinoma and melanoma. Next group is the colony stimulating factors. Examples are the sargramostim, which is very important, filgrastim, and pegylated filgrastim, which is known as a peg-filgrastim, for the better use or for the better utilization by the host. So, sargramostim is a recombinant granulocyte macrophage colony stimulating factor. Filgrastim only used for the granulocyte colony stimulating factor. Peg-filgrastim is a pegylated recombinant granulocyte colony stimulating factor. Recombinant interferons, examples are the interferon alpha, which is indicated for the variety of the cancers like the chronic myeloid leukemia, Kaposi's sarcoma, hairy cell leukemia, malignant melanoma, AIDS-related Kaposi's sarcoma. So, interferon alpha has a various different types of uses. So, first of all is the chronic myeloid leukemia, hairy cell leukemia, malignant melanoma, non-Hodgkin's lymphoma, AIDS-related Kaposi's sarcoma. Interferon B, limited use, again interferon gamma, it is used for the treatment of the chronic granulomatous disease. Side effects may be the flu-like symptoms. So, these are the immunomodulators. The salient features you have to know about the immunomodulators. First is the classification. What are the different types of drugs which can be used for the prevention or prophylaxis of the graft versus host rejection. And next is the different types of monoclonal antibodies. What are the chimeric antibody, monoclonal antibodies, and what are the humanized or by different technology, biotechnology which has been invented. So, these you have to know, and especially some uses of these monoclonal antibodies like the infliximab, basiliximab, omalizumab, rituximab. These are the important monoclonal antibodies you have to know about the different uses. Next, we are coming to the immunostimulants, which is also important. Especially you have to remember about the thalidomide, which has the side effects like phocomelia, which is a very serious side effect. So, you have to take care of this drug before giving, before prescribing to it through the pregnant mothers. So, it has been already been discussed. Next is coming important is the interferon. So, where we can use the interferons in the different kinds of disease, that is the interferon alpha, interferon gamma, it is used for the chronic granulomatous disease. So, you have to remember this, not very big questions will come, but the small questions, short questions and some discussion will come for these immunomodulators. Thank you.